Healthwise, brought to you by Winona Health. Healthy starts here.
Get down!
We're joined today by Dr. Daniel Parker of Winona Health. And Dr. Parker, it's nice to have you with us today.
Thank you. Happy to be here.
And we're going to talk today about a care team approach to healthcare. Can you maybe explain that a little bit?
I'd like to. I think that collaboration among caregivers has really given us an opportunity to improve quality of care and also improve cost and access. So we at Winona Health have been working for a long time to develop these teams and have rolled out several of them. I have the opportunity to collaborate with 3 nurse practitioners, and we're adding other members to the team that I believe just allow us to improve care in many, many ways. Access, for instance, if I have a patient that is not able to see me, there's often a slot on one of my collaborators' schedules for the day so that we can diminish wait times. Different perspectives. It's remarkable how many times someone looking at a problem from a different angle gives me new insights and thoughts about how to help patients. In the future, I think as the challenge of improving the cost or reducing the cost of medical care becomes even more critically important than it is now, we're hoping that these care teams will actually be involved in the community with our patients to prevent visits and prevent hospitalizations.
And again, you've touched on some of this, but how does a care team really benefit the patient?
Well, I think that first and foremost, it is improving care by utilizing multiple people with different knowledge. And we've just talked about providers at the moment, but we're now incorporating a care coordinator, which who will be an RN who will be intimately involved in their cares and how they're doing at home. In the future, we will pull in pharmacists, we'll pull in nutritionists, dietitians at particular days when we have needs to offer a more comprehensive approach to patient care at one particular visit, so you don't have to be going all around in multiple times. I think that's a great benefit.
So you talked about the team here at Winona Health. How does the patient then fit into this other than being the patient?
Well, there's a concept in medicine called shared decision making where the patient is really responsible for making decisions after accumulating and collecting advice and information, and the more comprehensive information that we can give them, more team members that we can, resources that we can give them access to, they are then enabled to make choices about the care that they want. I mean, that is just such a fundamental thing that, and it is somewhat of a radical concept that the patient is indeed the person who leads the team, and it's not just a, what am I trying to say? It's not, I do what the doctor tells me or what the provider tells me. What we want to know is we want to know within the framework of their life what is acceptable to them, how we can help them achieve the goals that they have for their life.
With an aging population, it seems like this may be a way to keep people in their homes longer as well? Is that kind of something you're looking at?
Absolutely, that's a very important aspect of this. You know, some of the care teams, well, we're developing a community network where we'll have community members who are trained, perhaps be observers in the home to give us clues about when things are not going well and when they are when something is in need of modification. There's a very acute time when somebody leaves the hospital about whether or not they're ill enough to be readmitted, and in order to, and having the ability to see them in their home environment will just, I think, decrease the chance they're going to have to be readmitted.
This is a very interesting topic, and I'm sure we'll be visiting more about it in future Health-Wise episodes. But Dr. Proctor, thank you for taking some time to talk with us today.
I appreciate the opportunity. Thanks.